The number of Coloradans 65 and older with Alzheimer's disease is expected to rise by the thousands in just a matter of a few years. That's according to the Alzheimer's Association, saying it's largely in part to an aging population.
The Colorado Department of Health and Environment just published a plan to mitigate its impact over time. I talked to CDPHE about the plan and met with a local man caring for his wife who's battling the disease.
She was the love of my life, always very understanding and best friend, lover, and spouse.
That's how 74-year-old Sam Van Wy describes his 71-year-old wife, Donna. The couple now lives in Castle Rock, married in Fort Collins in 1993, and it's been a life filled with a lot of memories. But some of those memories started to slowly fade for Donna in her early 60s.
The clincher was when she couldn't find Baskin-Robbins in Castle Rock.
After many doctor's visits, Donna was diagnosed with dementia caused by Alzheimer's disease. Sam says it's been a roller coaster ride since then and retired from his job in 2017 to be her caretaker.
Incontinence has been an increasing problem for about the year and a half. So I pretty much help her as she's getting dressed. She's called me Dad or Daddy most of the time for the last year and a half. And there have been times that she said, gee, I don't know where my husband is. Or she'll ask, are you married?
To help families like the Van Wys, the Colorado Department of Public Health published a 5-year state plan to mitigate and reduce the impact of Alzheimer's and related dementias for Colorado residents. The plan focusing on many things, including promoting risk reduction, early detection and diagnosis, and improving outcomes for people living with the disease. Joanna Espinoza-Robbins with CDPHE says up to 40% of dementias can be delayed or prevented by engaging in a healthier lifestyle.
It's things like controlling your high blood pressure or your diabetes or preventing diabetes, eating healthier, being more physically active.
The Alzheimer's Association estimates that the number of people 65 and older in Colorado with Alzheimer's and related dementias will rise from 76,000 in 2020 to 92,000 by 2025, and cost of care in the U.S. will go up from $350 billion in 2020 to over $1.1 trillion by 2050. But no matter the journey for this couple, Sam says he's in it for the long haul.
Hi, hon. How you doing? Been a different road than what I had been expecting. Love you lots.
The Colorado Department of Public Health and Environment hopes to implement the 5-year plan next year if they are awarded continued funds from the CDC. We have the full plan posted to our website, denver7.com. Now, a closely watched drug is showing promising signs of slowing down Alzheimer's. A new study shows lecanemab slowed cognitive decline among people with early signs of the disease. The drug targets certain proteins that build up in brains of those with Alzheimer's. Researchers say the drug is most effective in early stages, but more research is needed to determine its long-term effects.